Anita Kurian, and this is our COVID-19 update for the San Antonio community. We are celebrating a vaccination milestone tonight as we have surpassed 500,000 people in Bexar County with at least one dose of the COVID-19 vaccine. To be exact, as of yesterday's report, which now includes data from the VA, we have 524,642 people with at least one dose received, and a full 294,158 people are fully vaccinated in our community. Yesterday, I want to update you, my council colleagues and I voted in favor of establishing a pilot program for a community-wide wait list for a COVID-19 vaccination registration for individuals 65 or older. City staff are working on developing the central wait list, which will allow individuals to provide their contact information to vaccine providers. Staff expects to launch this effort within a couple of weeks. In the meantime, remember you can subscribe for vaccine alerts by texting vaccine or vacuna to 55000. As a reminder, Metro Health still has some COVID-19 vaccine appointments reserved for those who do not have access to the internet. If you do not have access to the internet, you can book your appointment by phone or by calling 311 and hitting option 8. The 311 hotline operating hours are Monday through Friday, 8 a.m. to 5 p.m., and Saturday and Sunday from 8 a.m. to 12 p.m. Tonight we are reporting in the COVID infections, we have 249 new cases of COVID-19, which brings our total to 205,777. Our 7-day rolling average is now 190. Unfortunately, we are reporting 2 more deaths from COVID in our community this evening. Please keep their friends and family in your thoughts this evening. We have lost far too many people in our community from this disease, and we want to remember them. Each and every one of these numbers is a loved one who we've lost, so please keep them in your prayers this evening. There are 185 COVID patients in the hospital this evening, and there have been, over the last 24 hours, 28 new admissions. 74 patients are in the ICU, and 32 are on ventilators. Let me turn it over to Commissioner Rodriguez.
Great. Thank you, Mayor. And as you mentioned, great news with respect to vaccinations in our community. I think the other good news, not just that folks are getting the shot, but that we're seeing an increase in the number of doses. I know we've all been waiting patiently about getting vaccinated. I talked to the University Health System earlier today. They normally get somewhere around 13,000 doses per week. Next week, they're getting close to 20,000, so over a 50% increase in the number of doses available for next week at least. We don't know if that's sustainable. It's kind of week by week, but we do know that next week their dose amount will go up from about 13,000 to about 20,000 available. So some good news coming. Some additional slots will be available through University Health. That announcement will be coming soon. In addition, an East Side location at St. Philip's will be announced. There should be about 5,000 slots available later in the week, next week. So again, we're going into next week, but some good news with respect to the availability of doses. We know that folks are waiting patiently, and so that's the good news. Just a quick word of warning as we go into a long holiday weekend. I know, Mayor, you've been talking about this as well, and the numbers bear it out. When you look back at the major holiday events going back 12, 13 months ago to Memorial Day, Independence Day, Thanksgiving, Christmas, now we're coming up on Easter, that there's a 2 or 3 week lag, but 2 or 3 weeks later, we show a significant spike, and we want to prevent that. I know a lot of folks are feeling a lot more comfortable because people are getting vaccinated, but we need to keep our guard up this holiday weekend. No large gatherings. If you can, stay outside. I know everybody's anxious to get together for Easter weekend, but again, we're making significant progress, and I think the only thing that can thwart that progress is if we let our guard down. So please be careful this weekend. Continue to mask up and have a great, safe holiday weekend.
Thank you very much, Commissioner. And as always, we are now featuring questions frequently asked to Metro Health, which we get to pose to our doctors right here on the air. So I'm going to ask the next question to Dr. Kurian, and that is, how do I know if my side effects are normal or if I should alert my doctor or healthcare provider after getting a vaccine?
So typically after getting a COVID-19 vaccine, It's normal to see to have pain and induration around the vaccination site, around the injection site. You may have low-grade fever, headache, generalized weakness. But if you experience symptoms outside of this, and especially symptoms like chest congestion or difficulty breathing, you may want to seek medical attention promptly.
Thank you.
And most of these symptoms should subside within 24 to 48 hours after you receive the dose.
Great. Thank you very much, Doctor. I'd also like to remind business owners that the city's Hospitality Grants Program application period is closing soon. That's on Monday, April 5th at 11 p.m. All submitted applications will be reviewed, and Lift Fund committed to awarding all grant awards within 60 days before June 7th. Recognizing the continuing need in the community, my council colleagues and I approved an additional $14 million in funding in late February to provide grants to small businesses in the hospitality industry with an emphasis on food and beverage establishments. Overall, the Hospitality Grants Program has $14.25 million available, and with an additional $250,000 from the Houston Street Tours Board Supplement Program for businesses located within that boundary. Businesses that need assistance can call 1-800-494-4973 to speak with a representative, or email sbcovidgrants@liftfund.com with questions or to schedule a consultation. Please visit cityofsanantoniorecoverygrants.com to learn more about the program and to apply before the deadline. You can also scan the QR code that appears on your screen right now to take you to that website. I want to give a special thanks to our partners at the Lift Fund, Janie Barrera, Selena Pena, and the entire team for facilitating the resources to assist small businesses with that program. And if you are struggling to pay rent or mortgage through this pandemic, you can get help by calling 311 or visiting covid19.sanantonio.gov to access our emergency housing assistance program. And if you're out of work and without an income and would like to train for a job that is available in our community today while receiving a stipend to make ends meet, you can call 210-224-HELP to enroll in that program. And as always, you can get the latest on COVID-19 and the vaccination process by going to covid19.sanantonio.gov. In the meantime, let's commit to protecting each other. Mask up, practice social distancing and proper hygiene. Do it for yourself, do it for San Antonio, and do it for our entire community. Thank you so much, and we will go to questions for Dr. Curie and myself and the Commissioner.
Can you discuss how the new pilot vaccine registry for 65 and up people works, and how registration will be more accessible for them?
So it's the registry is still in the inception. It's in the design phase, but the intent is to have a login access that's widely available, so individuals can sign themselves and place themselves up in this registry, or they can be placed by the delegate agency affiliations that they have. But regardless, the idea is to have a parking spot for 65 years and older to place themselves on a list to become eligible for an appointment as soon as an appointment becomes available.
For those wanting to register through this pilot program, will they be able to decide where they would like to receive the COVID-19 vaccine, or will their location be based on the zip code that they provide?
So this pilot program is going to be not catering to that particular need at this time, so they will have to take up the appointments that become available.
What was the key factor that led to the agreement of coming up with this wait list program?
So everybody's aware earlier this week, state had expanded the vaccine eligibility criteria. So at this time, all adults are eligible to receive the vaccine, but we know a significant proportion of our vulnerable population, which is 65 and older, are still are yet to be vaccinated. So this strategy was put in place to prioritize the vulnerable population. But I want to emphasize the goal is to vaccinate everyone at this time.
Dr. Kurian, the state says there are 278 people in Bexar County who have been vaccinated with an unknown age. We don't have the data for that. How does that happen in practice? And is it possible these are children under 16?
It's quite possible. And we have seen providers inadvertently administering vaccines to those that are under 16 years of age.
How does that happen? How do they get away with that, per se?
So when they are registering for an appointment, I can speak about the Alamo Dome. So when they are registering for an appointment, one of the variables we collect is the date of birth. But that is not a requirement. They can still register if that variable is missing. And we do make every effort to screen for those missing variables and age criteria on site, but sometimes it is possible that people might slip through without those screening measures, or in spite of the screening measures put in place.
Is that cause for concern given the FDA has not approved these vaccines for people under 16?
The current authorization is for 16 years and older for Pfizer and 18 and older for Moderna vaccine. So yes, those are, so when vaccines are administered outside of those emergency use authorization requirements, we do report it as part of our VAERS notification, which is your vaccine adverse event reporting, which goes straight to the CDC.
Mayor, a big threshold crossed with more than 500,000 people, at least one dose vaccinated. Have you all talked about the threshold for possible herd immunity through vaccines? And if so, what number would we be looking at?
Yeah, I would defer to the medical experts on that and Dr. Kurian. But I will say it is good to see those numbers go up in terms of the number of people in our community that are getting vaccinated. And I'm happy to report also that, as we've said every night, we've been banging on tables, calling our lawmakers at the federal and state level. We just got notified today that the public health administrators of this vaccine, and that includes WellMed, the city of San Antonio, UHS, are going to be receiving, starting next week, an additional 23,000 doses. So that doesn't include private doses that are going to be coming into providers, again, directly from the state that are not part of the public health administration process. So we are going to get a boost in the number of vaccines, and ultimately that's what will get us across this threshold of herd immunity.
Commissioner, can you tell us how many migrant children are currently at the Freeman and how many more y'all expect?
Sure. So I know as of today there were close to 1,000 totals, what I understand, at the Freeman complex. 500 that came in initially, I think, early Tuesday morning, and then another 500 or so yesterday. What I understand is capacity-wise, we're set up for right around 2,000. Maybe it's 2,100, I think is the exact number. But as of my conversation with the folks over there earlier this afternoon, the current volume is about 1,000.
Do you have an estimate on how long each child will stay and when they expect to be released to their families?
So I don't. I mean, I think everybody over there is working diligently to try and reunite these youngsters with a family member, however long that takes. I mean, I think it's trying to be done as expeditiously as possible. By the way, we need to give a huge shout out to our San Antonio community. I know myself, and I'm sure the mayor and many others have received an outpouring of support from people who want to come, who want to be helpful as volunteers, as we would expect, right, from San Antonio. People are stepping up here wanting to help out. But the folks over there from HHS, DHS, they're working to reunite these kids as quickly as possible, but we don't have necessarily a timeline for you.
Could you describe the situation inside the Freeman and which COVID-19 protocols are being exercised?
Sure. So I haven't been there since the kids arrived. I was there Monday afternoon, late afternoon, but I will tell you that they are practicing social distancing. They are requiring masks. There is a separate area that is apart from the general, staging area for those who test positive. By the way, they're being tested before they come and arrive here for COVID-19, and they're being tested every 3 days. So they're on top of it, making sure that everybody's safe, including the staff.
Dr. Kurian, we know Pfizer's vaccine, based off of information that was provided, gives at least 6 months protection. Has there been any conversation if that vaccine only gives 6 months protection of potentially having to contact people and revaccinate?
No, those findings are pretty preliminary, and we are looking for more data, more evidence, data-related evidence.
And with the number of COVID-19 cases continuing to, whether it's, go up a little bit, stay steady, or even go down, what would it take for us to say here locally that we are starting to see the vaccine dominate the virus instead of the other way around, where the virus is dominating the population?
We are closely monitoring our positivity rate and our number of new cases every day. As you can see, today we reported at least 200, slightly over 200 new cases. So unless the case rates go down and a positivity rate remain 3% or lower, we cannot let our guards down.
Spring break 2 weeks ago, we have seen that slight uptick, as was mentioned, for Easter upcoming this weekend. Specifically, I know the parks are going to be closed, and that is not going to be something that's going to be open as it was, 2019, 2018, and so on. But for people who are still considering gathering, this is obviously a concern for everyone. This could be potentially a super spreader event.
We say if you're going to be part of a gathering outside, to begin with, we don't recommend mass gatherings at this time. But if you're planning on being part of this, then make sure you take all the preventive measures that we've been recommending right from the beginning of the season. Consistent use of mask and physical distancing, even if you're fully vaccinated.
Yeah, and to be clear, Amanda, the parks are open. We encourage people to get out there, recreate, enjoy it. But Brackenridge is not open for camping overnight as it was 2 years ago.
Mayor,
Go ahead.
Mayor, could you reiterate the number of new vaccine doses arriving? Is it 23,000 collectively?
Well, we don't know the exact number because we only get direct report about hours that are going to be received by the public health administrators, and that includes, again, WellMed, Metro Health, UT Health, and UHS. We know that the number that they're receiving, augmented from the previous totals, would be 23,000. It's likely more than that because I would expect that private providers are also going to get a boost in their allocations as well.
Doctor, you indicated that date of birth isn't a requirement to sign up for a vaccine. I guess my question is, why not? And should it be, given the authorization guidelines that Pfizer's not good yet for 16 and under and Moderna for 18 and under?
As far as the registration site go, yes, it's not a requirement. Should it be made a requirement? I think in order to minimize the number of adverse events, that's a good idea to make it a requirement.
If they were to see someone that actively does not look 16, 18 above, that does look like they could be in elementary school, could they refuse to give them a vaccine?
Yes, and we do pull those people out. So parents are very eager to sign kids up. They want to make sure they take every step to safeguard their children's health. So sometimes, yes, that do happen. And when we see kids that are clearly underage, we pull them aside. But sometimes, like I said, we've had events where vaccines were given to kids under 16 years of age, and that's because they do look much older, and sometimes they don't have an ID to go with. And ID, we having a photo ID is optimal, but we don't refuse service to those who don't have an ID while they come to our sites.
Doesn't that open Metro Health up to some liability, though, if something were to happen to one of those children? I mean, couldn't you all get sued?
I don't know about the legal ramifications. I'm not a lawyer, so I'm not going to comment on that. But we make sure we take every precaution once something like this comes to our attention, which is monitoring them for extra additional post-vaccination monitoring period, and let them know, give them our medical director's information, and we also notify the CDC through our VAERS reporting.
Mayor, is the 23,000 new doses estimate for the mass sites collectively?
Yes.
That's all we have tonight. Thank you.
Thank you.